Yes, yes. Good evening, guys. I hope, yeah, the audio and visuals are perfectly fine. Yes, Spring Hearts, yeah. Yesterday, there was a power cut, guys. Yesterday, there was a power cut, and due to which I didn't like completed the topic. I was left with the synovial joints. So in today's lecture, guys, yes, Spring Hearts, I will be first completing the synovial joints, and then I will be moving on to the muscles wala part, right? I hope this is very much clear to everyone over here that I will be first completing the remaining synovial joints, right? And then I will be talking about, I will be discussing about the muscles in the general anatomy, right? So yes, yes, I hope the quality is perfectly fine here. Hmm, sure. So before starting that, just give me a thumbs up, guys, that please, yeah, the audio and visuals are perfectly fine. I hope you all can hear me. Yeah, I will be discussing all the topics, right? So please, take care. So, hmm, sure. Okay, perfect. Now let us now start. Good evening, Dr. H. Good evening, Dr. H. I hope everyone is listening me. Yeah, Mulat Hanusari. Okay, very good, beta. Yes. Now, guys, we are discussing about we were discussing about the plane synovial joints, and you guys already know that these joints where the articular surfaces are flat and the movement is only in the sliding motion wala part, right? Now, permitted only in the sliding motion. The movements are permitted only in the sliding motion. Yes, Eric, namaste. Namaste, Eric. So, again, guys, the examples are very important. Again, guys, the examples are very important. The very first example that you have to remember, it is the acromioclavicular joint. Yes, right? It is the acromioclavicular joint. Acromioclavicular joint. Write down all the examples, then I will explain you one by one. Yes. The next example, guys, you already know we have the intercarpal joints. Intercarpal joints. Then we have intertarsal joints. Intertarsal joints. Right? Intermetacarpal joints. Intermetacarpal joints. Yes, spring hearts. Right, guys. Yes, intermetacarpal joints, intermetatarsal joints, intermetatarsal joints. Yes, we have supero. Yes, spring hearts, very good. Umesh Prajapati, namaste, beta. So we have the supero tibiofibular joint, tibiofibular joint. Now, guys, just try to see all the examples. Just try to see all the examples, and I want to tell you that all the examples are very important. Now, coming on to the first example, guys, you already know that this is the clavicle bone, right? This is the clavicle bone. I already have told you. And this part of scapula, it is called as the acromion process. Acromion process of scapula. Acromion process of scapula. Now you guys already know, right? The clavicle and the acromion process of scapula. Now when I say process beta, process is bony extension. Bone का वो हिस्सा जो बाहर की तरफ निकला हुआ है, right? So we have the acromion process. Just like we have this process, and I want everyone to write in the chat box what is the name of this process which I have highlighted in the black color. Yes, what is this process? Process are bony extensions, guys, right? Process are bony extensions. So yes, this joint over here where you can see, yeah, between the acromion process and the clavicle, this is the type of a plain synovial joint, right? And this is called as the acromioclavicular joint. Acromioclavicular joint. Yes, very, very important. This is the acromioclavicular. Yes, spring hearts, very good. It is the coracoid process of the scapula. It is the coracoid process of the scapula. So this is the acromioclavicular joint between the acromion process of the scapula and the clavicle. Yes, Hinocoster, very good. Very good, guys. Coming on to the next example, guys, you already know that this is the skeleton of the hand, right? And over here, you can see that these are the carpal bones, right? We have already discussed the carpal bones. She looks too pretty. Try to catch her. Scaphoid, lunate, triquetral, okay, pisiform, trapezium, trapezoid, capitate, and hamate, right? So scaphoid, lunate, triquetrum, pisiform, yes, and trapezium, trapezoid, capitate, and hamate. Now, in between the carpal bones, now when I say intercarpal का मतलब क्या होता है बेटा? That is in between the carpal bones. So these are called as the inter means in between the carpal bones. So we have the intercarpal joints. Yes, the frantic. Okay, I'm not. Yeah. Yes, in between the carpal bones. Coming on to the next example, that is the yes, metacarpal joints. Now, guys, you already know in between the metacarpals. I hope you can everyone appreciate that these are the metacarpals. The first metacarpal, the second metacarpal, the third, the fourth, and the fifth. Numbering is always started from the lateral side to the medial side, or I can simply say the thumb side to the little finger side. Okay, from lateral to medial. So in between the carpal bones, I hope everyone can appreciate the one I'm, yeah, in between the, yeah, the metacarpals, right? These are called as the inter means in between. Which bones? Metacarpals. Intermetacarpal joints. Intermetacarpal joints. Yes, virtual reality. Good evening. Good evening. Intermetacarpal joints. So we have the intercarpal joints. We have the intermetacarpal joints. Now, similarly, we already know that these are called as the tarsal bones, right? These are called as the tarsal bones. We have how many tarsal bones are there, guys? Comment in the chat box. Yes, Springs heart. Yes. How many tarsal bones are there? Just comment in the chat box, guys. Fast. You already know in between the, yes, in between the tarsal bones, right? In between the tarsal bones, you already know we have intertarsal joints. Inter means in between the tarsal bones. Yes, George Azala, very good beta. It is 7. Spring Heart, Snellbury, very good. Virtual, nahi beta. Carpals होते हैं 8. Tarsals are 7 in number. Tarsals are 7 in number. Yes, virtual reality, it is 7. Yes, yes, you are right. Huh. Intertarsal joints. And again, you can also see, yes, the metatarsals. So in between the metatarsals, guys, okay, in between the metatarsals, we have the intermetatarsal joints. Intermetatarsal joints in between the metatarsals. So these are all examples of plain synovial joints. Okay. Yes. Yes, these are all the examples of plain synovial joints. Now, coming on to yeah, the next one, that is the superior-tibiofibular joint. You already know that this bone, it is the tibia. This bone, it is the tibia, and this is the fibula. This is the fibula. Yes, this is the fibula. Now, guys, you already know the tibia and fibula are the bones of the leg, right? The medial and the lateral bone. The tibia, it is the medial bone of the leg, and the fibula, it is the lateral bone of the leg. And when I say superior tibiofibular joint, I'm talking about the superior most part over here. That is the superior. It means superior tibiofibular joint. Tibiofibular joint. Superior tibiofibular joint. Very, very important. Yes, superior tibiofibular joint. Right? So that is again an example of, yeah, the plane joint. Even the sacrum and the ilium, the sacroiliac joint is again an example of plane joint, right? So the sacroiliac joint is again an example of plane joint. So you can add one more example over here, that is the sacroiliac joint. The sacroiliac joint. So I hope the plane, Khan Sahib, Assalamu alaikum. Walaikum assalam. Okay. So yes. So I hope this is clear. The plane synovial joints are clear to everyone. Just give me a thumbs up in the chat box, guys, if this is clear to everyone over here. Yes. Yeah, I hope the plane synovial joints are clear. All the examples that we have, sacroiliac basically means the sacrum and the ilium part, right? The iliac part or the ilium. Ilium, it is basically the part of the hip bone, and sacrum is a vertebra, and sacrum is the vertebra, right? So I hope this is clear to everyone. If you want, you can just see it over here. Let me just I have the picture with me. Yeah, just you can see the sacrum and the ilium. So this joint I'm talking about. This is the sacroiliac joint. Sacroiliac joint between the sacral vertebra and the iliac. Okay, the ilium part of the hip bone, right? Yes, yes. I hope this is clear to everyone now. I hope this is clear to everyone. The plane synovial joints. Now, coming on to the next one, guys. Coming on to the next one, that is the hinge joint, guys. Right? That is the hinge joint. Right? That is the hinge joint. Please ignore the comments. Right? Let it be. Some people are here for fun, so please kindly ignore. Yeah, the second one, it is the hinge joint. The hinge joint. Don't give him importance, otherwise no, these people will again, if the technical person is there, I would like kindly block this person. Yeah. Now hinge joint. Now when I say hinge joint, guys, now over here, I hope everyone has seen the hinge of a door, right? So over here, guys, remember the articulating surfaces. Yes, the articulating surfaces resemble the hinge of a door. Hinge of a door, right? Hinge of the door. Yes, the door. Hinge of the door, right? So the articulating surfaces basically resemble the hinge of a door. Now, guys, remember. Now, the movement over here basically occur around the transverse axis. Okay. Now, when the movement is occurring only around one axis, that is the transverse axis, and only two movements are possible, guys. Flexion and extension. Very, very important. Only flexion and extension is possible over here. Only flexion and extension is possible over here. So remember, yes, the two examples that you guys already know. Yes, yeah, we have the elbow joint. We have the elbow joint. Yes, virtual reality, let them, it hardly matters, right? And the spring hearts has already told the second one also. Yeah, the ankle joint. The ankle joint, right? Yes, the elbow joint and the ankle joint, right? And guys, one more example. Yes, one more example that you can mention over here. That is the interphalangeal joints. Very, very important. Interphalangeal joints. Now, guys, quickly comment in the chat box and tell what is the difference between flexion and extension. Okay, in which of the two movements the angle will increase, or in which movement the angle will decrease? चल, guys, फटाफट से comment कर दो. जल्दी से चैट बॉक्स के अंदर कमेंट कर दो. इन विच टू मूवमेंट्स द एंगल विल इंक्रीज? Yes, spring heart, very good. The decrease angle is the flexion one. Yes, George Izala, very good. The decrease angle, it is the flexion, and the angle which increases. So now when I say interphalanges, guys, now look at me. Now look at my hand over here. You can see the phalanges over here, right? You can see the phalanges over here, right? So we have 14 digits or 14 phalanges are there. Now when I say flexion, flexion means they will decrease the angle. Now these phalanges are in a form of a straight line, right? And in a straight line, the angle is 180 degrees. So again, when the angle will decrease like this. So you can see the angle is decreasing. This movement, it is called flexion. Interphalangeal joint. At the interphalangeal joints, you can see this movement, it is called as flexion. And again, if it is going back to its normal position, the angle is again increasing. This is called extension. So interphalangeal basically means in between the phalanges. Okay, in between the phalanges. Okay. So this is flexion where the angle decreases, and this is extension. Yes, Hina Cosset, Dr. Kanika Arora, very good, beta. Very good. You guys are right. Right, right. Okay. Now, ankle joint, elbow joint. Right? Now you guys already know this is the elbow joint. And if I have to now this is my whole upper limb, right? Now at the elbow joint, if I have to do flexion, I have to take my forearm towards the arm to decrease the angle. This is the flexion at the elbow joint. Again, to do the extension, I have to take my forearm, yeah, back to its normal position. This is extension. Angle का बढ़ना is extension, angle का कम होना is flexion. I hope this is clear to everyone over here. I hope this is clear to everyone over here. Yeah, sure. Now, interphalangeal joints, guys, you already know. I have already shown you guys that this is the interphalanges. These are the phalanges. Proximal phalange, middle phalange, and the distal phalange. Proximal, middle, and distal. And in between the phalanges, inter means in between the phalanges. So this is called as the interphalangeal joints. Interphalangeal joints. Interphalangeal joints, right? This is called as the interphalangeal joints, right? Elbow joint, so you already know. Ankle joint, right? I will be discussing all the joints when I'll discuss the respective limb, right? Now coming on to the next one, guys, the next one, that is the, yeah, the third one. The third one, that is the pivot joint. Pivot joint. Pivot joint, right? Now, now over here, basically the central part, right? Over here, the central bony pivot. Okay. Yes. 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 You guys are right. Now, the articulating surfaces. Remember, beta, the bones. Yes. The articulating surfaces. Basically, they consist of, okay, a central bony, or I would say the central axis. Okay. The central bony or the central axis part, it is formed by one bone, right? Okay, that is the pivot, right? It is surrounded by, okay, the central bony pivot, it is surrounded by a ring. Okay, it is surrounded by a ring which is partly bony and partly cartilaginous. So we have a central bony part, right? And on this particular bone, the other bone is rotating like this, right? The other bone is rotating like this. Yes, the other bone, it is rotating like this. So examples. Examples are again very, very important. The very first one, that is the superior, yes, and inferior radio-ulnar joint. The superior and inferior radio-ulnar joint. And guys, remember the second one that I think one of you have already told it. Yes, spring hearts, right? Yes, JBME, very good. Atlanto-axial joint spring hearts, you have already told this. This is the Atlanto-axial joint. Atlanto-axial joint. Now, or I would clearly say it as the median atlanto-axial joint, right? Now, now guys, you already know that I have discussed two movements, guys, supination and pronation. Now, while doing pronation, guys, right? While doing pronation, right? Now, pronation simply means when you are putting your palmar surface down. Pants नीचे की तरफ होते हैं. Similarly, the palmar surface, when it comes down or backwards, it is called as pronation, along with the forearm. Okay, the forearm also comes down. Okay, so to do the pronation, you have to do like this. Now, what is happening, guys? What is happening in this particular movement? If you can just see on the screen over here, that one bone, okay, one bone, basically the ulna, and we have the radius. So one bone actually it will form the, yeah, it will form the axis, okay, and the other one will rotate around it. The other one, it will rotate around it. So that is about the this one part and the atlanto-axial joint. Now, atlanto-axial, it is between the cervical vertebra. Now, guys, you guys are going to tell me how many cervical vertebra are there in the body. How many cervical vertebra are there in the body, guys? Come on, fast. Yes, spring hearts, very good. It is C7. We have 7 cervical vertebra, guys. Now, let me just show to you people. You guys already know we have 7 cervical vertebra, C1 and C2. Now, C1 and C2, yes, Hina Costal virtual reality, very good, guys. Yes, C1 and C2. The C1 it is the atlas and the C2 it is the axis, right? Atlantoaxial joint. Atlantoaxial joint. It means that we are talking about the C1 and C2 over here, right? So that is the this wala movement, right? So yes, this is the example of pivot joint, right? Pivot joint. Now coming on to the next one. Coming on to the next one, guys. The fourth one, that is the condylar joints. That is the condylar joints. Now, when I say condylar joints, guys, yes, Peter, total 26 vertebrae in adult. In newborns, it is 33, right? Spring hearts? Yes, yes, Azala, you're right. Yes. Now, when I say yes, condylar, or I can simply say it as bicondylar joints, right? Bicondylar joints or the condylar joints, right? Bicondylar or condylar joints. Okay. Now, over here, remember guys, basically the surface is in the form of a condyle. Now, when I say condyle, guys, condyle, it is actually the expanded portion of the bone at the ends. देखो bone, normally the bone is going straight like this, and if it is expanding at the end, it is called as condyle. It is called as condyle, right? So condylar basically consists of, right? Remember the articular surfaces basically they consist of two things, guys. They consist of two things, right? Now we have two separate convex condyles and remember two concave articular condyles. Very, very important. Now let us just try to see this with the help of an example, right? Now, what is the difference between concave and convex? Now, what is the difference between the concave and convex fell apart? You guys already know that, yes, if the outer surface is like this part is coming out, it is called convex. Now, if you guys already know, if we have a cave like structure, you can see a cave like structure जैसे cave होता है, so this is called as concave. If we are talking about the inner part, it is the concave. It is the concave. So we have two separate. Now let us discuss about, yeah, yeah, the knee joint especially, yes, the concave it is, you already know about this. Now let us just see about over here. You guys already know we have a bone called as femur, right? We have a bone called as femur, and femur is having two separate convex condyles, right? The femur it is having two separate convex condyles, right? So these are convex, right? So these are convex wala part, the rounded structures which you can see. And obviously we have the tibia over here, and tibia it is having these, yeah, depressions, right? The tibia it is having these depressions. You can see these are convex. Yeah, these are concave wala part. Okay, and this is convex. So this is called as the, yeah, this is the femur and this is the tibia. So this joint between the convex and the concave wala part, which you can see, this is called as the condylar joint. This is called as the condylar joint, right? This is called as the condylar joint, right? So this is example if you just want to mention over here. Yes, example if you want to mention over here, we have the knee joint. We have the knee joint, right? So in the knee joint, guys, in the knee joint, you can very well see, yes. Yes, it is, yeah, the knee joint, it is basically between the femur and the tibia and also between the femur and the patella. But specifically over here, I'm talking about the joint between the femur and the tibia, between the femur and the tibia. Yes, 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 guys, between the femur and the tibia. हाँ, ठीक है, springs. So you can very well see over here. Yes. I hope you all can appreciate this picture. Yeah, I hope you all can appreciate. This is the femur, right? And this is the tibia. This is the tibia. Now you all can see we have two condyles, right? Over here. These are convex condyles and we have two concave condyles over here, right? So yes. Now if I ask you a question, which bone doesn't participate in the knee joint? Femur, patella, tibia, fibula. Okay, answer this question. Which joint doesn't participates in the knee joint? So when I say knee joint, guys, when I say knee joint, okay, when I say knee joint, it is between femur and tibia, right? Between femur and tibia, and also between femur and patella. Femur and patella, right? Hina Passer, very good beta. Fibula, virtual reality, very good. Fibula never participates in the knee joint. You can see the fibula, it is not joined to the femur, right? So yes, we have this patella. Patella, it is present on the lower or the inferior part of the femur. And yes, so between femur and tibia, we have the condylar joint. We have the condylar joint over here. So I hope this is clear to everyone over here. Yes, Suman Parikh, very good beta. नहीं बेटा फिबुला होगा ना ठीक है चल so we have discussed the condylar joint guys right again there is one more example yes again there is one more example okay see movement also occurs in one plane over here the movement right the movement also occurs in one plane also occurs in one plane guys right it only allows flexion and extension right flexion and extension yes spring hearts very good the second one it is the temporomandibular joint the second example that we have to remember over here yes temporomandibular joint temporomandibular joint right we have the mandible part and we have the temporal bone, right? So it is the temporomandibular joint. If you just want to see over here, I think we have the part of the skull. Yes, the temporomandibular joint, right? You can see the mandible, guys, right? You can see the mandible and you can see the joint between the temporal bone and the mandible, right? So that is the temporomandibular joint. Okay, so there's limited movement in other plane guys over here so yeah very limited movement in other plane only one movement is finally complete that is flexion and extension so I hope the condylar joint it is clear to every one of you I hope the condylar joint it is clear to every one of you yeah now coming on to the next joint guys that is the ellipsoid joint the fifth one yes the fifth one fibula the Dr. H very good the fifth one we have the ellipsoid joint ellipsoid joint now when I say ellipsoid joint guys ellipsoid joint basically yes now here the articular surface remember here the articular surface basically it consists of yes convex oval surface I'm just talking about the shape of the articulating part that's what the basis of the classification convex oval surface right and elliptical convex surface elliptical convex surface so we have the convex oval surface and elliptical convex surface right now it is between the carpal bones and the radius yes the wrist joint beta the wrist joint huh let us just try to pen down all the examples first yes the very first one it is the metacarpophalangeal joint metacarpophalangeal joint right the second one metatarsophalangeal joint metatarsophalangeal joint yes spring hearts you are right the third one that is the wrist joint or wrist joint. It is also called as the radiocarpal joint. Radiocarpal joint. Now, when I say radiocarpal joint, it is between the radius and the two carpal bones. Now, the two carpal bones from the lateral side, we have scaphoid and lunate. Scaphoid and lunate. Yes, in a typical wrist joint, guys, the radius and the carpal bones only participate. Ulna does not form the wrist joint directly. Very, very, very important, right? Ulna does not form the wrist joint directly. Yes. So remember, it is the wrist joint. And the fourth example, we have the atlanto-occipital joint. Atlanto-occipital joint. You already know. Okay, let us discuss one by one. Metacarpophalangeal joint, guys. Now you already know these are the metacarpals. These are the metacarpals, and these are the phalanges. These are the phalanges. So in between the metacarpals and phalanges, this violet color which I'm highlighting over here, beta. Okay. So this is called as the metacarpophalangeal joint. The metacarpophalangeal joint. The metacarpophalangeal joint. Yes, the metacarpophalangeal joint, guys. The second one, guys, very, very important. We have the metatarsophalangeal joint, right? Between the metatarsals, and the phalanges. So we have the metatarsophalangeal joint, metatarsophalangeal joint, right? Between the metatarsals and the phalanges. Apart from that, we have talked about the wrist joint, guys. You can very well see this is the radius bone. This is the radius bone. And we have the lunate and the scaphoid. Okay. So this joint, it is the wrist joint. Or I can simply say it as the radiocarpal joint. Radiocarpal joint in between the radius and the two carpal bones, that is the scaphoid and lunate. The scaphoid and lunate, right? So yes, we have the oval surfaces of the carpal bones. We have this oval surfaces of the carpal bones, and along with we have the convex surface of the radius, right? We have the convex surface of the radius. So we have this convex surface like this, right? For to lodge these carpal bones into these convex surface, right? So that is about the this fella part. And yeah, atlanto-occipital joint. Yes, you guys already know at yes, we have this occipital bone, right? We have this occipital bone, and below the occipital bone we have the first cervical vertebra, that is the atlas. So the joint between the occipital bone and the atlas, okay, atlanto occipital joint, okay, that is the atlanto occipital joint. Okay, this is again an example of which joint? That is the ellipsoid joint. That is the ellipsoid joint. So coming on to the next wala part, I hope the ellipsoid joint is clear to everyone. Just give me a thumbs up, guys, if the ellipsoid joint it is clear to every one of you. Yes, the ellipsoid joint is clear to one and all over here. Coming on to the next one, guys. Yes, Hina Wasser, very good. Springs Heart, very good. Yeah. Chal. Chal. Now the next one, guys, the next one, that is the sixth one wala part, that is the saddle joint. That is the saddle joint. I hope everyone, okay. Now, anyone have experienced horse ride in your life? Just let me know. Suman Parai, very good. Anyone have experienced horse ride in your life? बताइए. Sure. Now you already know the seat of the horse. It is basically in the form of a saddle. It is basically in the form of a saddle. Okay. Basically, they are concavo-convex in nature. Okay. They are basically concavo-convex in nature. It is somewhat like this. Yes. Yes, sir. Yes. Very, very important. It is the articulating surfaces. the articulating surfaces are basically concavo-convex in nature. Concavo-convex in nature, right? They are concavo-convex in nature. Now, now the movements over here, basically they are permitted to flexion, extension, abduction, adduction, and very simple or very limited movement of rotations is permitted, right? So yes, 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 guys. So let us just try to pen down all the examples. Yes, the very first one that has been asked in the recent NEET PG exam. Yes, the examples. The very first one it has been asked in the recent FMG, the NEET PG exam, guys. The first metacarp, or just write like this: the carpo-metacarpal joint. Yes, just a minute. I don't know what happened. The first carpo-metacarpal joint. The first carpo-metacarpal joint. Now let us just try to look at this. Let us just try to look at this. What has happened here? Sure. Let us. This has been asked. The second one you should know, we have the sternoclavicular joint. Sternoclavicular joint. The third one, patellofemoral joint. Patellofemoral joint. And the fourth one, calcaneocuboidal joint. Calcaneocuboidal joint. The first, carpo-metacarpal joint, sternoclavicular joint, patellofemoral joint, and calcaneocuboidal joint. So let us just try to look at this case. The first carpo-metacarpal joint, I'm just trying to highlight this in green color. You have this first metacarpal, guys, right? This is the first metacarpal, right? And we have the carpal bone over here, that is the trapezium. So in between the trapezium, the carpal bone and the first metacarpal, okay, the first carpo-metacarpal joint, carpo-metacarpal joint. It is the saddle joint. This question they have asked, they have given a picture, guys. They have given a picture, and they have simply asked, yes, which joint is this? Yes, incudostapedial joint. Yes, I will be coming to that. You can even mention this. Yes, the incudostapedial joint also. Incudostapedial joint. Now, the second one, guys, the second one, that is the sternoclavicular joint, and I think you guys already know this. I'm talking about this particular joint. Yes, the sternum and the clavicle. The sternum and the clavicle. So you can very well see between the sternum and the clavicle this joint. Okay, that is the sternoclavicular joint. Sternoclavicular joint, right? That is again an example of a saddle joint. Again, the patellofemoral joint, that is, I have already shown you guys this, right? This is the patella and this is the femur. So between the patella and the femur, this joint, guys, that is the patellofemoral joint. It is again an example of the saddle joint. Yeah, and calcaneocuboidal joint. You guys already know. Yes, we have the calcaneum, we have the cuboid, and we have the calcaneum, that is the heel bone. So it is between the calcaneum and the cuboidal bone, that is the calcaneocuboidal joint. Calcaneocuboidal joint, that is again an example of a saddle joint, right? Calcaneocuboidal joint. And again guys, you guys already know that we have the three bones, the malleus, incus, and the stapes. The malleus, incus, and the stapes, guys, right? The malleus, incus, and stapes. This question has been asked in the NEET PG exam also. The incudostapedial joint is a type of a saddle joint. It is a type of a saddle joint, right? The malleus, incus, and stapes. Yes, Miss KK, very good, right? So I hope all the examples of saddle joint are clear to everyone. all the examples of saddle joint are clear to everyone, guys? Just give me a thumbs up. Now coming on to the last part of the joint. Coming on to the last part of the joint. Yes, yes, last NICET PYQ. Yes, yes, beta, very important. Yes, Hina Pausat, very good. The last NICET, this question has been asked. Now coming on to the seventh one, the last one. Yes, that is the ball and socket joint. And I think I don't even need to explain this, right? The ball and the socket joint. So we have four examples, guys. The four examples, remember we have the shoulder joint, we have the shoulder joint, we have the hip joint, right? We have the third one, that is the talocalcaneo navicular joint, talocalcaneo navicular joint, and sorry guys, I have just made a mistake over here. Yes, it is, yeah. In pseudostapedial, it is basically this ball and socket joint over here. Yes, the incudostapedial, it is basically the ball and socket joint over here, right? Whereas the incudomalleolar joint, it is, yeah, the incudomalleolar joint, it is, yeah, the incudostapedial joint, it is basically the ball and socket joint, right? This question has not been asked. This question has been asked between the incudo and the malleolar joint, right? Between the incudo and the malleolar joint, the incus and the malleus. So this question has been asked in the INI-CET. So yes, this is an example of a saddle joint, right? This is an example of a saddle joint, right? Huh. So just make this correction, right? Just make this correction. Between the incus and the stapes, we have the ball and socket joint, and between the malleus and the incus, that is the incudomalleolar joint, it is a type of saddle joint. It is a type of saddle joint. So yes, you have only commented and just yeah, check. Incudostapedial joint, right? So yes, the shoulder joint. Okay, we already know the shoulder joint. It is this joint, right? The shoulder joint. This joint, it is between the head of the humerus, right? Between the head of the humerus and the glenoid cavity of the scapula. So we have the head of the humerus, head of the humerus, and the glenoid cavity of scapula. Glenoid cavity of scapula. So yes, that is the shoulder joint. The hip joint, guys, you already know between the hip bone and the femur. That is the hip joint, right? It is between the femur, the head of the femur, and we also have the acetabulum of the hip bone. Acetabulum of the hip bone, right? So it is the hip joint, guys, over here, right? We have the talocalcaneo-navicular joint. You already know this is the navicular bone, this is the talus, and this is the calcaneum. So we have the talocalcaneo-navicular joint, right? So yes, the calcaneo-navicular joint. Yes, yes, spring hearts. I'll write it over there. Yes, I have. Yeah. Yeah, just mention over here. Yes, the fifth example, incudo-malleolar joint. This question has been asked in the INI-CET. Yes, the incudo-malleolar joint between the incus and the malleus of the bones of the middle, the tiny ossicles, right? So I hope this is clear. The hip bones, right? I mean, all the ball and socket joints are clear to everyone. The saddle joints, ellipsoid, condylar, hinge, pivot, and plain synovial joints. Just give me a thumbs up, guys, if this is done. If this is done, guys. Yeah. So, yes, I hope this is clear to everyone. Yeah. Just give me a thumbs up, guys. So I will be starting up with the next topic now. I will be starting up with the next topic. That is, yeah. Now, before that, guys, I would ask you to, yeah, do this homework, guys. Do this homework. Okay. Just do this homework, right? You have to mark out all the joints. Okay, you will write the name of the joints and the type of the joints in the entire picture of the entire upper limb and the entire lower limb. of the entire upper limb and the entire lower limb, all the joints. Okay, the very first acromioclavicular joint, which type of joint it is? Again, the name and this. Again, we have the humerus and the glenoid cavity. Okay, the shoulder joint, which type of joint it is? Okay, the elbow joint. Then we have the radiocarpal joint. Then we have intercarpal, intermetacarpal, interphalangeal. Okay, carpometacarpal. Okay, all the joints you will name it, and you guys will do this homework and you will send it to me on my Instagram handle, right? So it is Abhijit 7859, Abhijit Kumar 7859. You guys will send me this homework to my Instagram handle. Okay. Apart from that, guys, you guys will also do this homework. Okay. Just pause the video over here later. Okay. You will pause the video over here. You will read this clinical questions, right? And yeah, this is question number 1. Then we have question number 2 over here, right? We have question number 2 over here, and you will try to answer all these clinical questions in the comment section below. In the comment section below, I will be checking it. Yeah, all these three clinical questions, you will pause the video, you will read the question, you will read the choices, and you will mark the correct answer in the comment section below, right? Yes. I will be discussing the joints in detail, guys. Elbow joint, every joint. When I will be starting with the upper limb, the next part after general anatomy. So yes, I will be again starting with it. And this is again one more question we have. That is question number 4. So all the 4 questions, pause the video and just try to read the question and yeah, answer all the 4 questions, okay, in the comment section below, right? So I hope this is clear to everyone. All the joints are clear to everyone. The PPT will be shared. Now, guys, we are going to start with the next topic, that is the muscles. We are going to start with the next topic, that is the muscles, right? So put the heading as the muscles, guys. Put the heading as the muscles, right? Yes, this is a short topic. We'll just try to cover it ASAP, right? We'll just try to cover it ASAP. Now, guys, you already know, if we just talk about the definition of the muscles, you already know the muscles are the contractile elements of the body. The muscles are the contractile elements of the body. Muscles have the property of contraction of the human body, right? Now, you already know the muscles now have the property of becoming short in response to any particular stimulus, right? It can be due to no high excitability, all these things that you have discussed in physiology, right? See, high excitability of the plasma membrane of the muscle cells, right? Or there could be presence of these muscle proteins, the actin and myosin. So guys, you just have to remember, yeah, I will be coming on to the Hilton's law. I've already told about the Hilton's law, right? Now, guys, let us just discuss the types. Guys, you already know we have 3 types of the muscles, right? We have 3 types of the muscles, right? The skeletal muscle that we have to discuss in detail, guys. The skeletal muscles, right? We have the smooth muscles, and we have the cardiac muscles. So the cardiac muscles itself says that it is present in the heart. Smooth muscles are present in the walls of the vessels, right? The arteries and veins fall apart, right? Now, skeletal muscles are basically, these muscles are attached to the bones of the skeleton. So these muscles are attached to the bones of the skeleton. Okay, bones of the skeleton, and that is the point, or that is the topic of our discussion for today. So muscles are attached to the bones of the skeleton, right? You again, if we talk about the histological appearance, guys, the skeletal muscles are multinucleated. You guys will find many no nucleus, okay, and guys, one of the most important part, that you will see transverse striations, okay, you will see this transverse striations in these muscles, right? The transverse striations you will see. Okay, they are multinucleated, right? They are multinucleated. So we are talking about the skeletal muscles. right? That is our topic for discussion today. These are multinucleated, right? We have transverse striations, right? We have transverse striations, right? And they are under voluntary control, means we can control these muscles, right? They are under voluntary control, right? So yes, so without wasting much more time, so let us just start with the attachments of the skeletal muscle, right? Let us just start with the attachment of the skeletal muscles. Now guys, let us just try to draw a very simple diagram and try to understand. Now guys, you already know that, let us suppose that this is the muscle, right? This is the muscle, and this skeletal muscle has two ends, guys. This skeletal muscle has two ends, right? So this is a skeletal muscle. This is the skeletal muscle, and this muscle has two ends. This end is there and this end is there. We have two ends, and the okay, the central part of the muscle, it is called as the belly of the muscle. Okay, belly of the muscle. It is called as the belly of the muscle. Basically, it is composed of the muscle fibers. Okay, maximum amount of muscle fibers, they are no present in the central part. Okay, or I can simply say the fleshy part of the muscle. The fleshy part of the muscle, it is called as the belly, and we have two ends. Okay, the two attachments, basically they are there. The two attachments are there, right? We have two ends. We have two attachments. Okay. Now, guys, remember, one end of the muscle, it is called as the origin, very very important, and the other end, it is called as the insertion, guys. The other end, it is called as the insertion. Now a muscle, it is originating from one bone and it is going towards other bone. So we have one origin and one insertion. We have one origin and one insertion, guys. Now let us suppose now you guys already know that, yeah. Okay, let me just show one muscle to you guys. Okay, now if you can, okay, if you can see this, this is the biceps muscle, guys. This is the biceps. If we just take a very simple example, so the biceps is originating from somewhere and it is going towards another bone, right? It is going towards another bone. In between the part of the bone, it is called as the belly of the muscle, right? The belly, the fleshy part of the muscle, and it has origin and insertion. Okay, so you have to remember, guys, that we have one end that is called as the origin and the other end, it is called as the insertion. It is called as the insertion. Origin is always proximal, guys. Origin, it is always the proximal end of the muscle, and insertion, it is always the distal end of the muscle. Proximal यानी कि जो body में पहले आ रहा है, it is coming first in the body, it is more centered to the body. Proximal means center to the body. Okay, the origin is always centered to the body. The distal, it is always away from the body. The insertion part is always away, okay, from the center of the body. Again, guys, now the next part that you have to know, the proximal fibers of the muscle. Okay, the proximal fibers of the muscle are always fixed. Very, very important. Or in simple words, the origin is fixed, whereas the distal part, it is mobile, guys. Very, very important. The distal part, it is mobile. Okay, the distal part, it is mobile, right? So yes, you guys have to remember, we have the two ends of the muscles and the belly wala part. So yes, the proximal fibers, they are fixed. The distal part, it is mobile. The distal part, it is mobile. Now, let us understand this with the help of an example. Okay, coming on to a very simple example, guys. Right now, let me just show you. Now, guys, this is a muscle. Okay, let me just tell you the name of a muscle, that is pronator. quadratus. Again, the names would be very, very difficult to you people, but just try to understand one concept, what sir is trying to tell you. Now, this bone you already know we have, this is the ulna, and this is the radius. This is the radius, right? And this is the midline of the body. This is the midline of the body. Now, guys, which part of the muscle, okay, which part out of A and B, it is closer to the center of the body? Now you guys will tell me which part it is closer to the center of the body. Chalo, comment in the section. You guys are going to tell me out of A and B, which is the origin and which is the insertion. Out of A and B, which is the origin and which is the insertion, guys. Suman Parai, A, it is closer to the center. Midline body ka ye. Midline of the body is this. You guys already know this is the thumb. Thumb, it is always lateral, and little finger, it is always medial. Yes, George Zala, very good. It is the A wala part. A wala part which is more closer. So A wala part will become the origin and B wala part will become the insertion of the muscle. See, the muscle, it is attached to the bone. So that is a skeletal muscle, right? This muscle has two ends, one A and one B, right? Yes, Hina Koster, very good. Very good, guys. Virtual reality, very good. I hope you understand this part which I'm trying to not tell you guys that yes, that is about the origin and the insertion. Now guys, one more important concept that you have to remember over here, that the contraction of the muscle, okay, the contraction of the muscle will actually lead to the shortening of the muscle, will lead to the shortening of the muscle, right? Will lead to the shortening of its fiber, of its muscle fibers, the shortening of the muscle fibers. Now, what it will do? Again, you guys already know the origin is fixed. Origin तो fixed है. तो move क्या करेगा? Insertion वाला part. Okay, move क्या करेगा? Insertion वाला part. So thus, basically, it pulls the insertion. It pulls the insertion, okay, towards the origin, and it produces movement. It produces movement. तो movement हमेशा आपको insertional end पे ही देखने को मिलेगा, because the origin is always fixed. The origin is always fixed, guys, right? Contraction है muscles का, okay, what it will lead to? It will lead to the shortening of the muscle fibers. It will pull the insertion to the origin, and yes, this is the movement wala part, right? So I hope this is clear to everyone. Yes, I hope this is clear to everyone, guys. Just give me a thumbs up if it is clear. So yes, I will be talking about the attachments. Yes. Chal. Moon, very good. Hina Kausar, very good. Now coming on to the attachments. हाँ, वहाँ muscle movement होगी, very good. हाँ, Anita, very good. Yes. Hmm. Chal. Now let us now try to discuss the attachments wala form, right? So now remember beta, each of the two attachments, guys, you already know, when I say each of the two attachments, I'm talking about the ends, the origin and the insertion, may take one of the following patterns, may take one of the following patterns, right? May take one of the following patterns. The very first one, guys, it is the fleshy attachment. Okay, the fleshy attachment. Just we have seen in the case of pronator quadratus. Now let us just try to simplify it. What is this fleshy attachment means? Now, guys, you already know. Let us suppose that this is a bone, right? This is a bone, and the muscle, it is attached directly. The fleshy fibers of the muscles are attached directly to the bone. Okay, so the muscle is attached directly. The muscle is attached directly, right, to the bone, attached directly to the bone by fleshy fibers, by fleshy fibers, by fleshy fibers, right? We have no ends. The end is basically in the form of fleshy fibers. यहाँ पे बिल्कुल constricted and नहीं expanded end है. So yes, the muscle is attached directly to the bone by the fleshy fibers. That is the, yes, fleshy attachment, guys. That is the fleshy attachment. Coming on to the next one, that is the tendon. Coming on to the next one, that is the tendon. Now, there is a difference between the tendon and the muscle, guys. There is a difference between the tendon and a muscle. Let us first just try to look. Let us suppose that this is the bone, right? This is the bone, and the muscle over here, it is, now let us suppose that this is the muscle, and the muscle is basically attached to the bone with the help of a tendon, with the help of a tendon. Okay, the muscle is attached to the bone with the help of a tendon. So the tendon basically helps in the connection of muscle to the skeleton bone. Yes, yes, guys, you're right. You're right. Now, guys, you already know. See, almost the composition of muscle and tendon is the same. The tendon is also composed of no these collagenous fibers, right? Now, what is the main difference? The tendon do not contract, the tendon do not contract, whereas the muscle will contract, whereas the muscle will contract. The tendons do not contract, whereas the muscle will contract, right? Now, again, guys, the tendon, it is basically of two types. Very, very important. The tendon is basically of two types. We have, yes, the ribbon-like tendon is there, ribbon-like, right? That is the flat tendon we have. And also we have these cord-like tendons. We have cord-like tendons, right? If you just try to make your hand like this in the form of a claw hand, right? बिल्ली के पंजे जैसा बना के देखो. These rod-like structures, if you can just figure it out, touch it, guys. Just touch it, guys, and you will feel that just these are the tendons, the cord-like tendons which you can feel over here, right? These are the tendons which are helping in the attachment of the muscle to the bone. The tendons do not contract, whereas the muscles contract, right? Okay, so what is the function of this tendon? It concentrates the action of the muscle to a limited area in the bone. Okay, it concentrates the, yes, it concentrates the action of the muscle to a limited area in the bone, to a limited area in the bone, right? It concentrates the action of the muscle to a limited area in the bone. So it passes all the yeah, contraction to a limited area in the bone. So that is the difference between the tendon and the muscle. Coming on to the next wala part, that is the third one, that is the aponeurosis. Aponeurosis. Okay, aponeurosis. Now, when I say aponeurosis basically it is a flattened sheet. Okay, it is a flattened sheet of fibrous tissue. Okay, it is a flattened sheet of fibrous tissue. Okay, now this flattened sheet of fibrous tissue basically it is developed in the flat muscles, to provide wide attachment to the muscles, Now, yes, yes, Spring Hearts, you're right. Now, let us just try to look at this aponeurosis, guys. Aponeurosis, huh? Beta, you can just see that in the middle, okay? Yeah, okay, this is the posterior view. I don't think I have the interior view with me. Okay, anyways, guys, just try to listen, guys, over here. This aponeurosis, it is basically in the midline of the body anteriorly. नीचे abdomen वाला जो part होता है ना वहां पे होता है. You already know we don't have any bone in the anterior part of the abdomen, right? आगे की तरफ कोई bone नहीं होती. In the abdomen region, guys, you already know we don't have any bone in the abdomen region anteriorly, right? पीछे की तरफ तो फिर भी lumbar vertebra है, okay, which constitute the posterior abdominal wall along with the posterior abdominal wall muscles. But anteriorly we don't have. Now the muscles need a support system. Okay, we have the muscles in the anterior abdominal wall, the external oblique muscle, the internal oblique muscle, the transverse abdominis muscle. So there is a flattened sheet. Now when I say fibrous tissue, you guys already know fibrous is hard. Now it develops in these flat muscles which are located anteriorly to provide the wide attachment to the muscles. अगर ये नहीं होगा तो muscles will have no attachment, right? So there has to be some solid structure, and that is in the form of a aponeurosis, right? That is in the form of a aponeurosis. Now there is one more part that you guys should know, that is called as the intermediate tendon. That is called as the intermediate tendon. Yes, intermediate tendon. Now, you guys already know when I say intermediate tendon, so remember beta, it is a round tendon. It is a round tendon, right? Connecting two fleshy bellies together. Two fleshy bellies together. Now, if you just want to see over here, you guys already know that let us suppose that this is one of the fleshy belly of one muscle, and yes, we have this round tendon which is connecting these two fleshy bellies together. So this is called as the intermediate tendon. So we have belly 1, we have belly 2, we have belly 2. So basically it is a round tendon which is connecting the two fleshy bellies together, right? So yes, again there could be attachment to the cartilage also, right? There could be attachment to the cartilage also, right? So the muscles of the larynx, guys, the muscles of the larynx, you already know we have cricothyroid muscle. Okay, so the muscles are basically attached to the cartilage, right? The muscles are attached to the cartilage, attachment to the cartilage. So that is about the attachments. So I hope this is clear to everyone, guys. I hope this is clear to everyone, the attachment of the skeletal muscles. Just give me a thumbs up in the chat box if this is clear to everyone over here. Now, coming on to the next one, that is the forms of the muscles. Very, very important. The forms of the muscles. The forms of the muscles. Now, when I say forms of the muscles, basically, yes, I hope this is clear to everyone. Now, the form of the muscle basically depends upon the arrangement of the fibers of the muscle, right? To the line of pull. Now, let us just try to draw I will just try to draw, guys, and then I will explain you. Let us suppose that this is one of the bones, right? This is one of the bones, okay? Humerus and or any bone. I'm just talking about this elbow joint as of now, right? The elbow joint as of now, and let's just look at this. Now there is a muscle over here. There is a muscle over here, and you can all see this muscle, right? Now this muscle, now this is the muscle, okay? We have two bones over here, bone 1 and bone 2. So this muscle, it is originating from bone 1 and it is going towards bone 2. It is going towards bone 2. Now you guys already know we have one part that will be the origin of the muscle, one part that will be the origin, the other part will be the insertion of the muscle, the other part will be the insertion of the muscle. Right now, when I say the line of pull, basically it is the midline of this muscle. Yeah, the midline. Okay, in a vertical manner, if you can just see this is the midline, guys, right? This is called as the line of pull, the line of pull, right? Now, line of pull, basically it is a extending from line extending from origin to insertion, line extending from origin to insertion. This is called as the line of pull. Guys, this is called as the line of pull, line extending from the origin to the insertion wala part, right? Now, now guys, now you guys already know basically muscles are classified, muscles are classified according to the arrangement of their fibers into four main forms, into four main forms. So muscles are classified according to the arrangement of their fibers into four main forms. Now the very first one, guys, that you have to remember over here, yes, muscles. Okay, let me just try to write it nicely on the next slide. Yes, the very first one that you guys have to remember, yes, the muscles with fibers parallel to the line of pull, parallel to the line of pull. Now, the muscles with fibers parallel to the line of pull. Now, guys, they are classified into three categories. Number one, we have the, yeah, let me write it with, yeah, the blue color. Number one, we have the quadrilateral muscle, the quadrilateral muscle, right? Now, you guys already know the, yeah, the quadrilateral muscle means it will be having four sides. It will be having four sides, guys. You can just see in the picture, this muscle, it is having four sides, right? Now, let us suppose that this is the origin and this is the insertion. This is the origin, this is the insertion as given in the picture. So the fibers of the muscles are basically parallel to the line of the pull. Let us suppose that this is the line of the pull. Line of pull, it is basically line extending from origin to insertion. So the muscle fibers are also parallel to this. They are also parallel to this and they are basically having the shape of a quadrilateral. Okay, and example that you guys have to remember, it is pronator quadratus muscle, pronator quadratus muscle. Again guys, the name justifies itself. Pronator, मैंने पहले भी बताया था in the muscle movement, pronation. Okay, quadratus means you can see it is having four sides, quadrangle, right? The four sides. So yes, yes guys, this is the pronator quadratus muscle, the fibers which is parallel to the line of the pull. If you can just see over here also, the muscle fibers are parallel to the line of pull. Line of pull क्या है? Origin से insertion तक वाली जो line है उसे line of pull बोलते हैं. The second one, it is strap like. Okay, strap like, खींचा हुआ, ठीक है, extended, strap like. So the next one, the next category that you should remember, the strap like muscles, the strap like. Okay, now the strap like, it is basically yeah, divided into two categories, guys. Over here, the two categories, we have category number one, that is with fleshy insertion, with fleshy insertion, and yes, the second one, it is with tendinous. मुदस्सिर अहमद बेटा, लाइन ऑफ पुल क्या होता है? देखो, ये ओरिजिन है बेटा, ये ओरिजिन है और ये इंसर्शन है. ये वो लाइन है जो ओरिजिन से इंसर्शन तक जाती है. A simple hypothetical line extending from the origin to the insertion. ठीक है, और इसी लाइन के पैरेलल अगर मसल्स हैं, ठीक है, तो पहली कैटेगरी वही है जो भी मसल फाइबर्स है इसी लाइन के पैरेलल है. I hope the yes, Mudassir, I'm coming to the strap like muscles example. Yeah, I hope this is clear, Mudassir. Yeah, Ahmed, with fleshy insertion, and the second one, it is with tendinous insertion. With tendinous insertion, guys. With tendinous insertion, with fleshy insertion, and with tendinous insertion. Now, with fleshy insertion, the example over here, guys, it is the sartorius muscle, the longest muscle of the body, the longest muscle, also called as the honeymoon muscle. Yes, you guys will tell me why it is called as the honeymoon muscle. So I'll not reveal it. It's okay. And with tendinous insertion, you guys are okay. This I think everyone knows. It is rectus abdominis muscle. Rectus abdominis muscle. Now let us first come on to the sartorius muscle, guys. Sartorius muscle, you can see it is the longest muscle of the body. It is coming from the, yeah, the hip bone, right? The hip bone, right? The spines, the ASIS, right? And guys, you can very well see the insertion on the tibial part as well. So it is the longest muscle, guys, and the muscle, it is like a strap, खिंचा हुआ strap. Okay, so yes, this is the strap like muscle. Again, this is not the rectus abdominis wala muscle, that is again located in the front wala part. So rectus abdominis, I don't have the picture with me. Yeah, but as of you should guys remember, when I say rectus, rectus का मतलब होता है बेटा straight. Rectus means straight, and abdominis means the abdomen वाला muscle. So these muscles have tendinous insertions. बीच बीच में ना white color के tendons बने होते हैं. If you can just see over here also, these are white colored tendons. These are straight muscles. Rectus means straight, and the part of the abdominal Latin में उसको straight बोलते हैं. ठीक है, और बीच बीच में जो टेंडन्स, जो 6 पैक्स होते हैं, 8 पैक्स होते हैं, अगर ये टेंडनस इंसर्शन 6 है ना, अगर if a person is doing so much of gym also, right, he will never get 8 packs if there are only 6 tendinous insertion. In spite of doing gym for almost 20 years, he will never get those 8 packs. So in anatomy, these are those tendinous insertions which you can see. These are strap like muscles, right? The third one, guys, that you have to remember over here, that is the fusiform muscle. The fusiform muscle, it is just like in the shape of this. Yeah, let me just draw it with the red one. Yes, it is just like in the form of this, the fusiform appearance. Okay, the fusiform appearance, right? The fusiform appearance. So the example over here, guys, remember it is the lumbrical muscles, right? The lumbrical muscles are there. The lumbrical muscles are there. The lumbrical muscles are there. Now, when I say lumbrical muscles, guys, you can very well see over here. Lumbricals, right? You can see that these are these lumbrical muscles, right? These are fusiform muscles, right? The lumbrical muscles, right? The lumbrical muscles, right? So yes, now coming on to the next one, guys, the next part that you have to discuss, right? That is the muscles. So earlier we have taken a category where the fibers were parallel to the line of pull. The muscles with the fibers parallel to the line of the pull. The second category, guys, it is fibers. Okay. Now second category, the B category, guys. Yes, muscles having fibers oblique to the line of the pull. Oblique to the line of the pull, right? So muscles having fibers oblique to the line of pull. Okay. Again, this is something additional that we have to remember with pinnate arrangement. I think some of you have already told this. Yes, with pinnate arrangement. Pinnate arrangement. Okay, the pinnas, right? The leaves, the pinnas, right? The pinnate arrangement. Now, guys, the very first one that you have to remember, it is classified into unipinnate, we have bipinnate, multipinnate, and we have the fourth one, that is circumpinnate. So it is classified into 4 types, right? Uni, bi, multi, and circumpinnate. Okay, unipinate, bipinate, multipinate, and circumpinate. Now, when I say unipinate, right? Now, guys, let us just try to see this. If suppose this is the tendon, guys. If suppose this is the tendon, right? The muscle. Now, let us suppose this is the tendon which I have drawn, and we have only one side. The muscle uni means only one, right? The muscle will be only on one side, and the muscle fibers are arranged like this. I mean, they are oblique. Okay, they are oblique in appearance, right? Like this, guys. So this is unipinate. They are only present one side and the muscle fibers are oblique to the line of pull, right? They are going oblique. So example guys, yes, we have the unipinate. The examples, yes, yes, you already know we have the first and the second lumbricals, guys. The first and the second lumbricals. If you can just see, guys, over here, if you can just see over here, let me just show you guys. Yes, yes, guys. You can see the first lumbrical that is having only one side, right? This is the first unipinnate. The second also it is unipinnate. Okay, it is having only one side. The third and fourth, guys, the third and fourth, you can see they are present on both sides. Okay, that's why they are bipinnate. They are bipinnate. So first and second lumbrical, right? It is unipinnate. The third and fourth lumbrical, it is bipinnate. If you can just see, it is present only. See, this is in between. We have this tendon, right? And to one side of the tendon, it is present, right? This is first lumbrical. This is the second one also. This is, you can see, this is the tendon, and to this tendon, this is the second one, and the third and the fourth, they are bipinnate. Okay, they have two pinnas, right? They have two pinnas like this. Okay, so I hope this is clear. I hope this is clear, guys. Everyone, just give me a thumbs up. Yes, the first and the second lumbricals are unipinnate. Bipinnate, yes. Let us just try to draw the diagram as well. Now in the bipinnate, we have the tendon over here. From the tendon, yeah, the muscle fibers are going like this, right? Yeah, in an oblique manner to the line of the pull. Yes, it is going like this, right? So this is bipinnate. This is bipinnate, right? Examples you have to remember. We have the third and fourth lumbrical, the third and the fourth lumbricals, and along with this, there is one more muscle that is called as the rectus femoris muscle. The third and the fourth lumbrical. Along with that, we have the rectus femoris muscle, right? The rectus femoris muscle is also bipinnate. Rectus means straight, femoris means the femur bone. Yes, I don't have that image right now. Yeah, the rectus femoris muscle. Yeah, rectus means straight. Now coming on to multipinnate. Multipinnate, guys, you already know they will have multiple pinnas, right? They will have multiple pinnas, right? So let us just try to draw it in a very simplified manner. You guys already know they will have these tendinous insertions, right? So these are all converging, and we have these, yes, we have these tendons also, right? So this is the tendon wala part also, right? So we have these multipinnate muscles, and this is the tendon, and these multipinnate muscles having these fibers running in an oblique manner, right? So it is somewhat like this, guys, right? Multipinnate, right? So yes, multipinnate, right? So it is actually a series of these bipinnate bands. Okay, they are just arranged side by side. Okay, these are these bipinnate band. Yeah, they are arranged side by side, and remember they all have a common tendon, guys. They all have a common tendon. So basically these are series of these bipinnate bands, and they are arranged side by side. Example over here, very very important. We have the deltoid muscle, guys. We have the deltoid muscle. This is the muscle where you get all the vaccines and the injections, right? The intramuscular injections. near the shoulder wala part. If you can just see beta, this is the deltoid muscle. Deltoid muscle has three origins, right? One from the clavicle and two from the scapula, guys. Two from the scapula. And this muscle, it is coming from the clavicle also, it is coming from the scapula as well. So this muscle, this is the lateral view, right? The side view, guys, which you can see. And this is the deltoid muscle where you get all the intramuscular injections, right? So this is the deltoid muscle. You can see these um, like the muscle fibers, right? They are converging and they all have a common tendon, right? They have all have a common tendon. So yes, they all have a common tendon and that is inserted into the deltoid tuberosity of the humerus, right? So that is about the multipinnate. And now coming on to the circumpinnate, basically remember there is a centrally placed tendon in between. So remember guys, in the circumpinnate, you should remember that there is a, yeah, centrally placed tendon, which is no, where all the fibers, guys, where all the fibers, basically they are converging to this centrally placed tendon, right? They are converging to the centrally placed tendon. So it is somewhat like this. All the muscle fibers are now converging to this centrally placed tendons, right? Now, all the fibers, they basically converge from all sides, okay, and they are attached to the central tendon. So this is the centrally placed tendon, right? And example you have to remember, it is tibialis posterior. Tibialis posterior muscle. Now, when I say tibialis, guys, you already know we have the tibia bone, and this muscle is posterior to the tibia, right? So yes, this is the tibialis posterior. If you can just see, we have the tibialis posterior. So we already know we have the tibia bone, and this is the posterior view, guys. This is the posterior view. So the name itself justifies tibialis posterior. So it is an example of circumpinate muscle. Circumpinate muscles. Now, guys, again, we have discussed two categories, guys. The first category was the fibers parallel to the line of pull. The second one, it is the fibers oblique to the line of pull with pinnate arrangement. Now, the third category, it is only fibers oblique to the line of pull without pinnate arrangement. So, the third category that you guys have to remember that, yes, muscles with having fibers, muscles having fibers oblique to the line of the pull, oblique to the line of pull, and it is without pinnate arrangement. The former one was with pinnate arrangement. Over here, it is without pinnate arrangement. Without pinnate arrangement, guys. Without pinnate arrangement, right? So, in this category, the very first one that you have to remember, we have like, yeah, 4-1, we have the triangular muscle. We have the triangular muscle. The second one, we have the cruciate muscle, the cruciate or X-shaped muscle. The third one, we have the spiral muscle. We have spiral muscle, right? And the fourth one, it is circular muscle. It is circular muscle, right? Triangular, cruciate, spiral, and circular. So the triangular muscle, the example that you have to remember, it is temporalis muscle. It is the temporalis muscle. Temporalis muscle. Now, you guys can see over here in this particular picture, this we have the temporal bone over here. So this is, you can see the shape, it is in the form of a triangle, right? It is in the form of a triangle. So temporalis muscle, it is basically, yeah, the muscle. Yeah, it is the temporalis muscle, the triangular muscle, the cruciate or the X-shaped muscle. So the muscle is like this, guys. The muscle is like this in the form of an X-shaped. Example, you have to remember, it is the masseter muscle. Masseter muscle. Masseter muscle. And you can just see over here in this picture only, we have this masseter muscle, right? So they are going just crisscross like this. So masseter muscle. Okay. The third one, guys, that you have to remember, that is the spiral muscle. That is the spiral muscle. Now, spiral muscle, it is basically just spiral in shape like this, right? Spiral in shape like this. This muscle is there, right? So yes, let us just try to, yeah, this, suppose this is the bone. This muscle is spiral in shape. This muscle is spiral in shape. And the example over here, it is the supinator muscle. It is the supinator muscle. Okay, the supinator muscle. Triangular वाला इस तरीके का होगा, right? The supinator muscle, guys, right? You can see the supinator muscle over here, right? This is the supinator muscle. Okay. So yes, this is spiral. You can just see the alignment. It is going like this, right? It is the supinator. And the fourth one, guys, you already know we have the this muscle, that is the orbicularis oris around the mouth, right? So this is orbicularis oris, the rounded muscle. Orbicularis oris, that is the circular muscle, right? Orbicularis oris. So remember, guys, the circular muscle, we have the example orbicularis oris, orbicularis oris muscle, the circular muscle, right? Present around the lips, right? This we have the orbicularis oris. So the third category is also done. The muscles having fibers oblique to the line of pull without pinnate arrangement. The former one was pinnate arrangement, and the very first one that we have discussed, the fibers parallel to the line of pull. Now coming on to the last category in this case, that is the D part, yes, muscles with separate heads of origin, muscles with separate heads of origin, muscles with separate heads of origin, right? Now it is classified into four types. We have biceps, we have triceps, okay, or let us just write like this. Follow the color code, yeah. Write down, you already know we have biceps, then we have triceps, we have quadriceps, and yes, we also have digastric muscle, right? Digastric is one of the type where no, you can see it is with two bellies. Let us first discuss this. It is with two bellies, okay, and we have their intermediate rounded tendon is there, right? We have this rounded tendon. I have already shown you this, right? So yes, so digastric muscle, yeah, they have two intermediate origins, right? Two different origins are there, yeah. So obviously, but the intermediate tendon is there. Okay, now guys, coming on to the biceps wala part. Okay, coming on to the biceps wala part, you already know biceps muscle. Okay, it is having two heads, triceps three heads, and quadriceps four heads. Now, when I say two heads, it means two origin. Three heads means three origin. Four heads means four origin, right? We have four origins of the same muscle. Now, if we look at the biceps over here, guys, if we just try to look at this biceps, you guys can very well see this biceps, it is having two heads, guys, right? It is having two heads. One, it is coming from the coracoid process. Now, this is the biceps. Biceps. Bi का मतलब ही क्या हो गया? दो origin. One, it is coming from the coracoid process, and the other one, it is coming from the top of the glenoid cavity, supraglenoid tubercle, right? So we have two origins bit over here, two origins of the biceps. Now, if we talk about the triceps, see, this is anterior. Biceps आगे की तरफ होता है, right? और पीछे की तरफ क्या होता है? Triceps. पीछे की तरफ क्या होगा? Triceps. Yes. Anterior and posterior belly out digestic. Yes. Now, this is the posterior view. This is the posterior view, and you can see we have these triceps muscle. We have these triceps muscle. One origin, it is coming from the infraglenoid tubercle. Okay, एक scapula से. The two, we have the lateral the lateral head of the triceps, and below the long head, we have long head of triceps, we have lateral head of triceps, and we have medial head of triceps. Obviously, let us suppose if this is the midline of the body. So one, it is the long head coming from the infraglenoid tubercle. Other one is on the lateral side, lateral head of triceps, and one on the medial side, we have the medial head of the triceps. Okay, the short head is absent. So you guys can very well see we have the long head, yeah, the lateral and the medial head having three origins. The two origins, the lateral and medial, it is coming from the humerus, right? It is coming from the humerus, while the long head, it is coming from the scapula. It is coming from the scapula. Now, apart from that, guys, you have to remember the quadriceps wala part. So quadriceps is again having the four. Okay, you guys can see this is the biceps. This is the biceps. Yes, and this is the triceps. This is the triceps. Long head, lateral, and medial head. Okay, long head, lateral, and medial head. Right now. Apart from that, quadriceps, it is having basically four heads, right? The quadriceps femoris, okay, and digastric, you already know. Now, I hope this is clear to every one of you. This is clear to every one of you. All the forms of the muscle, they are very, very important with separate head of origin, with fibers oblique to the line of pull without pinnate, and fibers oblique to the line of pull with pinnate arrangement, and the fibers parallel to the line of pull. The fibers parallel to the line of pull, right? So I hope this is clear to every one of you. Yes. स्पाइरल मसल में एक चीज और याद रखिएगा या वन इन द नीट 2018 या द स्पाइरल मसल we have one more example. Yes, that is the pectoralis major. Okay, one more example that you have to remember in spiral, that is the pectoralis major. It has been asked in NEET 2018 exam, pectoralis major muscle. Okay, that is the spiral muscle, right? Or I can simply say twisted muscle, the twisted muscle, right? So if you just want to see over here, so this is the pectoralis major. This is pectoralis major muscle. Okay, so this is an example of a twisted muscle, or yeah, yeah. So I hope this is clear to everyone. The spiral or the twisted muscle, right? Right. So again, now coming on to the action, and action, just you have to remember the action of the muscles. Okay, actions in a very short, I will tell you. We have the prime movers, guys. The prime movers, the actions of the muscle, they are prime movers. Okay. Now, these are the muscles, no, they will initiate a particular movement, okay, at the desired joint. For example, you already know brachialis, brachialis. Now, तुमने आर्म रीजन में बस biceps और triceps पढ़ा है, ऐसा नहीं होता है, ऐसा नहीं होता है. You guys have to remember one more muscle over here that is called as brachialis, guys. Brachialis as of now. If you remove the biceps, guys, if you remove the biceps, then you will be able to see this muscle. Okay, it is the deep muscle. This is called as brachialis. This is called as the brachialis muscle. Now this muscle, it is responsible for flexion at the elbow joint. जो हम ये flexion कर पा रहे हैं ना बेटा, ये कौन सी मसल की वजह से होता है? Brachialis. Brachialis is the strong flexor at the elbow joint. Okay, it is a strong flexor at the elbow joint. So this flexion, it is basically by the brachialis muscle. So it is a prime mover, guys, right? So yes. Now if we talk about the triceps, so ये flexion के लिए होता है. Now you already know we have the triceps. Triceps, it is behind, and it is for extension. It is for extension. Very, very important. I will be discussing with each limb, with each anatomical region, all the muscles, all the origin, insertion, action, okay, nerve supply, everything. But as of now, the basic idea should be clear, right? Again, we have antagonistic or opposing muscles, guys. We have antagonistic muscles, or opposing muscles, okay, or also called as the opposing muscles. Now, these are the muscles which oppose the action of the prime movers. For example, brachialis flexion कर रहा है और triceps extension कर रहा है. So they are antagonistic actions. Okay, so they are done by the antagonistic muscles, right? Now we have the third category over here that is called as the synergic or synergist. Okay, synergist or synergetic muscle or synergistic muscle, right? Now, synergistic is one muscle basically no helps in the movement of the other muscle as well. So yeah, so yes, I hope this is clear to everyone. Yeah, just give me a thumbs up, right? So we have synergist also, and we have okay, one more category that you can remember. We have fixators also, right? Fixators, or I can simply say that stabilizers also, right? Stabilizers also, right? So synergistic, basically, they actually what is the function of the synergistic muscle? It's basically the stability of the joint is okay. It is the main function, right? The stability of the joint, okay. Actually, the synergistic muscles are those muscles which help the prime mover muscles, right? Which help the prime mover muscles, and the fixators ones which actually basically fix the bone of the no, they fix the bone of the origin of the prime mover, right? For example, the muscles of the shoulder girdle, guys, right? The muscles of the shoulder girdle coming from the clavicle, coming from the scapula, right? The deltoid muscle. So these are called as fixators, or they stabilize the shoulder joint or the shoulder girdle. So that is again an example of fixators, right? So that is in turn about all the things that we have discussed today, right? The muscles. So in the muscles, just remember not the definition. Obviously, the attachments you have to remember: the tendon, aponeurosis, intermediate tendon, fleshy attachment, and the forms of the muscles, the line of pull, origin, and insertion. Okay, the fibers parallel to the line of pull. Okay, the fibers oblique to the line of pull with pinnate and without pinnate. And the fourth one that we have already discussed with the separate heads of origin: biceps, triceps, quadriceps, and the actions, right? The prime movers, antagonistic, synergistic, and fixators. I hope this is clear to everyone. So just give me a thumbs up, guys. Yes, just give me a thumbs up that you have understood the today's lecture, and let us complete this general anatomy part 7 tomorrow. And yes, after that, please type in the comment section which topic you guys want me to start, right? So I will be doing everything in detail, guys, just for the first years. Okay, and the ones who haven't done anatomy before, this will be a piece of cake for you people, right? So thank you, guys.